Okay, everyone. I think we're going to get started. It's just a bit after 10. I want to welcome everyone to our CoMoHelps Nonprofits Partner Meeting today. I think we've got an excellent presentation for folks, and really pleased to be able to join our nonprofit partners. I know we have a close relationship with a lot of you guys, and I know I personally miss seeing everyone, and hope everyone's doing well. Today we wanted to just invite you to give an update. I'm going to show the agenda here in just a minute and introduce our panelists. We do want to remind folks, everyone should be muted. Our panelists can unmute themselves. If you have questions, if you would, send those to the chat and send those to Kristen Cummins. And at the end, we'll have a question and answer section. Just a reminder to send those chats directly to Kristen so she can watch those. And we'll probably save most of those to the end so we can move through things and we can cover those. I'm Steve Hollis. I'm the Human Services Manager for the City of Columbia and Boone County here at Columbia-Boone County Department of Public Health and Human Services. I'm also the ESF6 lead, that's Mass Care and Human Services in our incident command structure. And so I'm involved with multiple aspects of our response to the pandemic, and one of which is to help to coordinate our efforts with our fellow funding partners here. And so we have gathered our CoMoHelps partners and some other guests today. And I'm going to just quickly cover who's on the panel so that you guys know. And we've got a slide up here with everybody, but with the county, with Boone County Community Services Department, we've got Joanne Nelson, Megan Corbin Bonilla, Kristen Cummins. With City of Columbia Community Development, we've got Randy Cole, the Housing Program Manager, and also Lee Kotwitz, who is the Neighborhood Services Manager. Randy is helping to run long-term recovery from an economic recovery standpoint. And then Lee is coordinating donations and volunteer management as part of the emergency response, and we'll go over that a little bit. I introduced myself. We also have my friend and colleague, Michelle Scheichels, who's our health promotion supervisor. Michelle has been doing a lot of work on our business guidance and helping folks either stay open or get back open. So she's going to go over some of our key business guidance items, particularly those that apply to the nonprofits. We've got John Baker, who's the director of the Community Foundation of Central Missouri. We've got Andrew Graybaugh, who is the executive director of the Heart of Missouri United Way. We have Jesse Yankee, who's the director of the Missouri Women's Business Center. Jesse's going to touch on the Triple P program with us a bit. And then we've got Eric Morse, who is the board president of the Veterans United Foundation. Also, I'd be remiss if I didn't point out that today's Eric's 40th birthday. So since everyone's muted, I will not sing that by myself because that would be awful. But big happy birthday to Eric on a big day. And he's taking time off from his birthday celebrations to join us. So happy birthday, Eric. Our agenda today is pretty basic. We want to give an update on COVID-19, including the kind of incident command structure, just so people have some sense of how that works. We want to talk a little bit about the business guidance, and then we're going to talk a little bit about Triple P. We want to talk to you guys a little bit about the information that we've gathered from the funding requests and allocations that we've made through CoMoHelps, and talk a little bit about what that looks like and look ahead a little bit. We also have the results from our survey that Megan's going to share with folks. And then we want to talk at the end about the local funding and how to differentiate between CoMoHelps and some of our regular funding sources, and just a look ahead. And then we'll wrap up with questions and answers. So let's jump into our COVID-19 update. I just want to give a quick overview of the incident command structure. Boone County is pretty unique. We have a dedicated Office of Emergency Management through the county, um, but we have a system by which most of the functions in an incident command or emergency management are run by governmental entities. In a lot of smaller communities, it's kind of a hodgepodge of different entities. And here we typically have governmental entities leading each of what we call essential support functions. So for example, you can see that our director is running operations because this is a public health emergency. And under her command, I'm running ESF 6, Mass Care and Human Services. Scott Clardy is running our health and medical. Randy is helping us out with long-term recovery. Randy's really focused on the economic recovery side. In a more typical disaster, we would focus on human services and infrastructure, and less so usually on economic recovery. This is such an unusual emergency in many ways, but we're really having to focus on the economic recovery. So Randy Cole has been kind of leading that effort and organizing that effort. We typically coordinate the human services and mass care long-term recovery response, but we're just kind of keeping that within ESF 6, because if you think about a typical disaster, it's a tornado, and we do a response and we make sure that people are sheltered and have clothing. And then we shift into long-term recovery human services, where we try to get people rehoused and back to work and get kids back in school. And this is such a glacial emergency that things are very different. So big thanks to Randy for helping out there. You also see Lee Kotwitz in that structure. Lee is running donations management and volunteer management. And then we have asked the United Way and the Community Foundation to be the recipients of financial donations, because neither the city nor the county are well positioned to receive donations. So big thanks to the Community Foundation and United Way, but also we were able to get Veterans United Foundation to be a partner in that as well. And that's been a really neat effort, and that resulted in CoMoHelps, which is why we're here today. So I didn't want to get too much into the weeds on this, but I did want folks to have some sense that there's a very organized approach. And needless to say, the reason we do this is we've learned over the decades that you can have disasters within disasters when things are not coordinated and communication breaks down. And I have to say, I've been doing this in Boone County for over 20 years, and I see what happens in other communities, and folks should feel really good about the organized efforts here in our community. So with that said, we thought an important thing to cover today, and we did hear back from you guys in the survey, was to talk about the business guidance. And we do think of nonprofits as very much being businesses. So we have a wide variety of nonprofits. So today, we ask Michelle Scheichels, our health promotion supervisor, to join us to give a kind of a quick overview of business guidance, but also some things applicable to nonprofits specifically. And then also, Michelle was going to address some of the themes that we saw in some of the questions from the survey. So Michelle, I'm going to turn it over to you.
All right, thank you. So as you mentioned, first I'm just going to go over our current health order. So our current order came into effect on Tuesday. It will be in effect for at least 4 weeks. And we use that period of time because that gives us a couple incubation periods so we can see what changes need to be made and make changes based on epidemiological data. So in our current health order, we open businesses that are open to the public is how it's worded, but it's retail and similar businesses. They can be opened at 50% of the capacity. Currently, the governor's order limits these businesses to either 10 or 25% capacity. So at this time, they're limited to 10 or 25% capacity, depending on the size of the facility. And the governor just extended his order yesterday, and so that will be extended to at least June 15th. So they will follow that guidance until June 15th unless it is extended. Entertainment facilities can be opened at 50% capacity or 50 people, whatever is less. Gatherings of any kind, public or private, are limited to 50 people. Businesses that are not open to the public, and these include businesses that people come to by appointment. So that may include many of your businesses. There are no limitations on capacity for them, but they do have to abide by the social distancing requirements that I'll go over here in a second. Close contact businesses, so these include childcare, day camps, personal care services. They are limited based on the number of people. So childcares and day camps or similar programs are limited to stable groups of 25 children. And what we mean by stable groups is the same 25 children need to be, or max of 25 children need to be in the same group each day, all day, to the greatest extent possible. And groups should not mix or combine at any time. And for personal care services, these are services where the person providing the service must come within 6 feet to provide the service. So hair salons, barbershops, things of that nature. Limited to 25 people. So that includes staff and customers. Sports, this includes formal sports or like sports that you would, if you have a program that brings together kids to just engage in physical activity via sports. We are not allowing contact sports at this time, but contact and limited contact sports can be conducted with a stable group of 25 people. And then our parks and trails have been open, but now our playgrounds are opened as well. And in our order, we have what we call social distancing requirements. And these requirements were in our last order, and they will likely be in our future orders. And what they include are things that all businesses and organizations and individuals need to engage in order to comply with the order and also to be safe. The first is maintaining a 6-foot distance between individuals. So businesses need to figure out, or entities need to figure out how they can do that. Washing hands with soap and water. To comply with this, businesses just need to make sure that soap and water or hand sanitizer is made available. Not shaking hands, covering coughs and sneezes with something other than hands, avoiding shared items and disinfecting items that are shared between use. So that is one thing in the guidance that you'll see anytime there's a shared item. Our guidance will include how to disinfect it in between use. Limit customer to employee contact to one-to-one. So we are trying to limit as much as possible people's interactions with a number of individuals. And so one way we can do that is having one employee interact with one customer, as opposed to a customer interacting with a number of employees on staff. And then cloth face coverings are recommended in public settings where social distancing measures are difficult to maintain. Go to the next slide. There we go. And here are some guidelines for all businesses, and hopefully they're applicable to a lot of the businesses or the organizations that you are a part of. First and foremost, don't allow employees who are sick to come to work. Have policies in place so employees can stay home if they are not feeling well. Practice social distancing to the greatest extent possible by maintaining that 6-foot distance between individuals. And so if you are an entity that has people working in desks, make sure the desks are 6 feet apart. Your break room, chairs should be spaced 6 feet apart. In all locations of your building, your waiting rooms, etc., make sure that the facility is set up so people who are coming in will naturally maintain that distance. It does say here to the greatest extent possible. If you are working with children or something like that, It is, of course, not possible for you to maintain that social distancing. We do expect that you will have interaction with, especially young children that you are working with, but it is to the greatest extent possible. Minimize face-to-face interaction. This is to protect your staff and, of course, your patrons, your customers. Maintain disinfection plans for the premises. So your disinfection plan should include what disinfectant you're using, and the EPA does have a long list of disinfectants that are approved for COVID-19, and it should include how often things are being disinfected and what is being disinfected. It should also include who's responsible to do the disinfection. Avoid shared equipment and materials if at all possible. This includes things like phones, pens, etc. Eliminate non-essential travel. Limit capacity according to the most recent health order. And I think it jumped. Promote proper hygiene, so have Kleenexes, soap and water or hand sanitizer available, and encourage your employees to report health and safety concerns, and then post a sign at your entrance that states that if an individual is sick, that they should reschedule their appointment. You can go to the next slide. And these are just some guidance that is for human service organizations. I understand that you all are different, but if you are an organization that does consultations, or if you typically see people by appointment, consider doing phone consultations or Zoom appointments. Offer curbside services if possible. Close your waiting rooms, or in your waiting room, set up chairs so they are 6 feet apart. Use screening questions to screen your clients before they enter. Of course, clean and disinfect. Next slide. If you operate an out-of-school program and you're working with children, go ahead and follow the child care guidelines outlined in our business guidance document. That includes the stable groups, the no contact sports, and the social distancing requirement, and limiting the shared equipment. And other human services, so for food banks, follow grocery store guidance. Homeless shelters and shared and congregate housing, there is a lot of specific guidance in the business guidance document. Much of it comes directly from the CDC, so please check that out. There's, for homeless shelters and shared and or congregate housing, there is quite a bit of guidance. So if you have questions on that, please let us know. If your business or organization does not fall within the parameters of what I discussed, you are always welcome to send in a question. You can send your plan, your social distancing and disinfection plan, to businessguidance@como.gov, and we will respond. It typically takes us about 1 to 3 business days to get back to you, but we'll respond. We'll review your plan and give you our feedback. Some questions that we had. One of the question was where the guidance is located, and that kind of prompted us to think we need to relocate it because it was challenging to find. Now I have moved it, and it is a direct link on our website. So if you go to como.gov/coronavirus, on the available resources, it's the 4th one down. It says business guidance, and that will link to our entire business guidance document. And then there were several questions about specific entities. There's a question about fitness centers. They do maintain that 50% capacity. Day passes are allowed, but you would want to keep a list of who was there each day in order for us to conduct effective contact tracing. And then we had some questions about masks. We do recommend masks. If they're not mandatory, they are voluntary. but we do recommend them in settings where social distancing is difficult to maintain. We do not recommend them for children under the age of 2 or anybody who is unable to remove the mask on their own. Right. I think that's all I have.
We appreciate that so much. And again, if folks have specific questions, it's really probably best just to go ahead and email them businessguidance@como.gov. We've noticed that while we do try to capture some general guidelines by business type, many times folks need pretty specific guidance to their operations, and we are more than happy to address those questions. Again, if you'll email businessguidance@como.gov, that goes to a whole team. That lets us respond quickly, and it gets us to the right folks. If you do have kind of general questions, feel free to chat those to Kristen. But if you have specific questions about your particular business operations, then go ahead and send that email. And again, many thanks to Michelle. Okay. Up next, I'd like to introduce my friend and colleague, Lee Kotwitz. Lee is our volunteer, I'm showing my old days here. She is the manager of neighborhood services for the city, and that includes volunteerism. And so Lee, I'm gonna turn it over to you to talk a little bit about volunteer coordination during the pandemic. Lee, if you're speaking, you may be muted.
All right, there we go. Well, good morning. Just want to touch a little bit on volunteer management. It is part of our emergency response plan. It's an ESF 7 as part of resource and supply. This time, we did not have a lot of needs for volunteers really due to the nature of the emergency, but we know in other times of disaster, that's going to be different. So if you think of a flood, tornado, some other natural disaster, the volunteer needs are going to be different, and we're going to have more of an opportunity for volunteers to serve. For this particular event, if you do have needs for volunteers related to the emergency response, if you could let me know that. We do have a page on CoMoHelps that includes our local volunteer opportunities, and we have been collecting a list of people that have an interest in emergency response. So we'd be happy to share those needs. And again, if those are related to your response with COVID-19. And then also just a thought about moving ahead. In years past, and I've been around for a while, kind of like Steve, we have done some exercises around preparing to manage volunteers in time of disaster. And this event was really a wake-up call to do that. So I want to throw out that invitation that I think there is a need for those of us that have some role in volunteer coordination to connect, to do some exercises, to think a little bit more about how we would manage volunteers during a disaster. And I think there would be some value in that even beyond emergency management. In years past, we have had a more of a network and a connection of volunteer coordinators, and that's kind of fallen away. But I think this is an opportunity for us to gather together and talk more about how we can cooperate and also work with Boone County Office of Emergency Management on volunteer coordination. So I'm going to drop my email in the chat as well. And if you do have any volunteer needs or want to be involved in future exercises, let's be in touch and talk this summer. Thank you.
Lee, thanks so much. And again, we've posted some volunteer needs as we've gone along for agencies such as the food bank. If you guys do have volunteer needs, we are more than happy to post those on our volunteer page. And that is linked off the CoMoHelps.org site as well. So folks can see that, get to that pretty easily. And Lee, thanks again. Up next, I'd like to introduce Jesse Yankee. Jesse's the director of the Missouri Women's Business Center. We noticed in the survey, it looked like we had about 45 respondents. It looked like about half respondents applied for Triple P. So we thought it'd be a good idea to have someone come on to talk about Triple P, and just give an overview and then potentially be a resource for questions about that. So with that, I'll turn it over to Jesse. Jesse, thank you.
Thanks, Steve. Yeah, I'd love the opportunity to talk. I just have a brief little statement about the Paycheck Protection Program, because there's still, as much as it's been in the news, people still don't really understand it or know the fine details about it. So if you haven't applied for the Paycheck Protection Program, it's something you should look at, and I'm happy to walk you through that. Even though we are the Women's Business Center at CMCA, we work with nonprofits, we work with men, so don't feel like you are not eligible to work with us. You absolutely are. So the program is still open until June 30th. So you have until June 30th to get your application in. If you've even applied and been denied, that's okay. I'd still like to talk to you and get you connected to a bank that might be able to help you. One misconception about this program is that you have to have all the money spent by June 30th. And that's not the case. It's you have 8 weeks from the day that your loan is funded. Or if you're on biweekly payroll, so say we got a loan at CMCA this week, we wouldn't start it until June 1st when our payroll runs. So, so the thing is people, we're getting a lot of questions about, I haven't had to lay anyone off, so I don't feel like I deserve this opportunity. And I really don't think you should think like that. All of the public backlash has been about, publicly traded companies took a large chunk of the first round of PPP. And that's what it's about. I talked to 2 different bankers at Columbia Banks yesterday, and they had the same thing where they're getting clients that are like, I don't know if I should do it. This money is for you. This is taxpayer dollars. You shouldn't feel bad about using this money. It's essentially a grant when used correctly. So, I think you all know the things you can use it for in terms of all your payroll expenses, mortgage interest, utilities, rent, all of those things. So that's the overall view of the Paycheck Protection Program. And then if you go to the next slide, there's also, of course, the employee retention payroll tax. So you can't use both of these, but you can use one of them. And so you would want to talk to your CPA before you accept a PPP loan about which one of these items is going to be more beneficial for your organization. So if you don't take a PPP, you might be looking at the tax credit situation. Check with your CPA because you are all eligible to receive one or each of these things. So one or the other, sorry. So anyway, I'm happy to answer any questions about PPP. And I'd love to hear from you guys offline about why you didn't apply for it. I'd love that feedback. So it's just Jesse at mowbc.org. I'd love to talk to you guys more about that.
Great, Jesse, thank you. Yeah, we one of the things that we're going to look at when we receive CoMoHelps applications, particularly if it's an application to support things like salaries and operational expenses and rent, things that are actually eligible for Triple P. Probably one of the first things you'll hear back from us is whether or not you applied for Triple P. So again, really encourage people to do that. And if you don't have a relationship with the bank, you can always call someone like Jesse who has watched this and help folks out. The other thing is turn to your peers and your colleagues. I know several of the agencies have successfully navigated this program, and my experience in our community is that the nonprofits are always willing to help each other out. So Jesse, thanks again. Really appreciate your being with us today. Okay. I want to turn to some information about the CoMoHelps funding. Again, that is a partnership that was formed in response to the pandemic by the city, the county, the Community Foundation of Central Missouri, the Heart of Missouri United Way, and the Veterans United Foundation. Many of you, I'm sure, have seen the CoMoHelps.org information on our site, I hope. And we've received several applications. I think we're getting close to over 70 applications. We do look at those daily. We have a daily call, talk about those, decide who's going to be the lead partner. Many of those proposals have been jointly funded. And we wanted to tell you kind of what that's looked like so you can have an idea of the kind of funding that's been provided. So with that, I'm going to turn it over to several of our CoMoHelps partners. And We're going to start with John Baker, the director of the Community Foundation.
Thank you, Steve. Good to be here with the rest of you today. We've had a good time working as a collaborative, receiving these applications and choosing those that seem to be needing funded most immediately and have the most complete information that seems to relate to the pandemic. I thought we'd provide a few slides here, letting you see some of the fiscal realities of what's been going on. This simple bar graph simply shows that around $120,000 in qualified applications has been received and reviewed. We have received additional applications that were not really fitting for this particular time, so those are not included in this total. But of these dollars and these applications, you see that around 61% of them have been funded already, 712,000, pushing 713. We have 314, closer really now as of today, closer to $400,000 of pending requests. We've had some large ones come through just in the last few days. And of all the requests, about 12% of those, or $141,000 in total dollars, were deemed inappropriate at this time, or the application was simply not in line with our work. So this just gives you a simple way to look at the amount that's come in, the amount that has been funded, and what is still pending. I will say that we do not at this moment probably have all of the dollars needed to act on everybody's requests. So we've had very generous people locally, but our income is not quite keeping up with the application requests. So that's something which we'll be attending to in some way in the months to come. And that's all I have on that slide, Steve.
Thank you, John. Appreciate it. I'm going to turn it over to Joanne Nelson. Joanne's the director of Boone County Community Services Department, which oversees the Boone County Children's Services Fund and the Boone County Community Health Fund. So Joanne, I'll turn it over to you.
Thanks, Steve. I would be remiss if we didn't give a big shout out to Megan Ritza with the Veterans United Foundation, who has really put this report and helped us put this whole report together. As you can see on this slide, its services funded through CoMoHelps have been very varied. We've got food, we've got healthcare. And you can see that the that food is the biggest one that we've funded. This makes sense because of the nature of COVID-19 and the priority to address basic needs in members of the community. Many items in the organizational support includes items identified to be longer term recovery issues. So you can see that in the yellow, especially with organizational support and healthcare. So those are items, especially with that $175,000 with the organizational support. So those we'll be looking at in long-term recovery, and then, like John said, trying to look for funding, additional funding to help support some of those measures. Thanks, Steve.
Thanks so much, Joanne. Next up, we've got Andrew Graybaugh. Andrew's the director of the Heart of Missouri United Way.
Thanks, and thank you, everyone. I appreciate your participation today. Really, this is just another detailed look at the funding that through CoMoHelps. And really, I'm not going to go through all of these percentages and figures here because this will be made available after this meeting, as you know. But I do want to just point out that this shows the alignment between the areas identified under the emergency support function, the ESF, and how CoMoHelps then looks at directing its funding through grants to connect with that as well. And so you can see here that the grand majority of the requests around mass care and human services is really the area that our support is focused on as well. So again, I won't go into much detail about this because it'll be shared afterwards, but it's a good snapshot. And thanks again to Veterans United for putting this together.
Thank you, Andrew. Appreciate it. Speaking of Veterans United Foundation, I'm going to turn it over to Eric Morse. Eric's currently the board president of the foundation and the birthday boy. So Eric, take it away.
Steve, thanks for giving me a simple graph to read through. I don't know if I could have gone too much further than that. What you're seeing here is how the different funders are coming together. And so Steve, at the beginning of this, shared how unique and great of an opportunity this is for these different funders to collaborate in this way. And it's been really helpful for us all to come together every day and analyze the different requests so that we can all be aware of what's going on from a larger perspective. And then also figure out, once we decide as a group what is needing to be funded right now, then also who is best to be able to meet those needs. Sometimes that's based on partnerships that we already have, understandings that we have of the different organizations. And also, as you can see here, there are different groups that have a different focus on some of the different areas that they're able to fund as well. So hopefully here you can see a little bit off to the right, it's been made pretty simple, broken down into just a few different groups for you. And then this is how it's been spread so far with the funding pretty consistently as well.
Great. Thank you, Eric. And as Eric alluded to, it's a very unusual partnership. We're not aware of any other communities with this many funders that have formed a single process and for both giving and then for allocating resources. So it's been a really amazing opportunity to work together. And again, we do meet every single day to talk about needs and talk about applications and resource allocations. So thanks so much to our partners. We're going to move on to the survey that so many of you were kind enough to apply. I know we're all extremely busy, so we really thank you for your time. We did kind of close that version of the phase of the survey, but we do plan to reopen that. We'll probably send that link in the follow-up email. And as a couple folks have alluded to, we are recording this this meeting, and also obviously we can share the PowerPoint. We'll do that. So it'll be available both as a video and the PowerPoint itself. And also we anticipate sending a new opportunity to reply to the survey. And that's really important. And I want to thank Megan Corbin, Benia, and Rachel Delco from United Way for putting this data together. They did a lot of hard work, and Megan is going to share that with you now.
Thank you, Steve. So just a little bit of overview about who completed this survey. We had 45 organizations respond, and I just want to say thank you for taking the time out. We know this is an incredibly busy time that is constantly changing, and so taking the time out to do this somewhat lengthy survey is appreciated. This information here shows the organizational budgets of those who completed this survey. So it's pretty varied on the sizes of organizations who provided feedback. And then if we look over at the organization type, this was what was self-identified by respondents. And if you took that survey, you probably recognize this. A majority of the respondents identified as a human service organization, but we also had health organizations and then organizations that didn't really fit within these kind of clear categories complete the survey as well. Moving on to our next slide here, we asked some very detailed questions about the impact of the COVID-19 pandemic on current and your anticipated revenue throughout this year of 2020. Overall, it looks like currently 42% of our nonprofit partners completing the survey expect an increase or no change to their overall revenues, which means about 60% of respondents are currently dealing with decreased revenues across their agencies. 53% of our nonprofit partners anticipate somewhat or significantly decreased overall revenue through the end of the year as well. And nearly 20% are unsure of how this pandemic is going to impact their budgets. There's less than a third of folks who think that this is not going to impact their budget or anticipate increases of any kind, which is really telling, especially that unsure number. I think that's, you'll see throughout this, is there's just a lot of uncertainty. When we look at the current increases, we worked really hard to try and to develop a projected number so that we can have some goals for both with CoMoHelps and then looking forward into long-term recovery. At this point, we anticipate almost nearly a $2.5 million increase. For the 5 respondents who said that they expected an increase. I want you to remember with some of these numbers, they reported different amounts or different time frames. And so it's not like, you know, over the next 6 months, we're going to have this. So this ranged from 2 years to a successful campaign that just ended. federal CARES funding, CoMoHelps funding, and increased donor support were identified for those increases in revenues. Unfortunately, though, it does look like there's going to be around 2.8, almost $2.9 million worth of decreases that people are currently facing. And so this is for the 21 respondents was about $142,000. A lot of the reasons for these current decreases included postponed or canceled fundraisers, an inability to offer services due to the safety and just the nature of the COVID-19 pandemic. And then issues with billing with a purchase of service model, which is how things are here at the county. We then wanted to look at some of the impacts on fundraising and how this might impact our sector over this next year. So we both looked at currently and what we're anticipating right now. 36% of our partners identify that they are currently experiencing significant or somewhat or no changes in their fundraising revenues. However, again, that's almost nearly 60% are expecting significant or somewhat of a decrease. Looking forward throughout the end of the year, 50% of our partners expect decreased fundraising dollars. We have seen a modest increase in fundraising dollars for the 2 respondents who reported that. And they really talked about how they were changing their fundraising strategies and how some of their donors are seeing these increased needs and increased awareness of these needs. Looking at the fundraising decreases, however, paints a very different story, showing that $1.5 million is kind of the expected decrease across those who responded. Again, postponed or canceled events, fewer individual or business donors, or being involved in the crisis response has impacted individuals from being able to fundraise as effectively as before. And I think it's really important to remember that due to the nature of the COVID-19 pandemic, it may not be feasible to be holding any fundraising events in person this year. And so we're really encouraging our nonprofit partners to be adaptable and to think of other ways to hold their traditional events. Some of the survey respondents mentioned holding virtual events, changing strategies, and how they've had some moderate success with that. I think it's going to be really important looking forward as to change the way we've traditionally done things given this pandemic. And then moving on, we asked a very clear question of, do you anticipate a budgetary shortfall in your current fiscal year? You know, about 20% said no, 32% said yes, but over almost half of folks completing this survey just weren't sure. And I think that this kind of underlies that uncertainty that we don't know, are we going to be back? Are we not? How's it going to look? So being able to be adaptable is really important in this time, which I'm sure you all no doubt know. Across the 8 respondents who provided enough information to gather this information or to gather this projection, it was going to end up being an average of almost $110,000 deficit that folks are facing in their budgets, and those are pretty big numbers. And then finally, looking at the impact of across services of the COVID-19 pandemic, there are currently, it looks like that first orange bar, there's a lot of variability around the current needs for services. So while some organizations are seeing some increases, others are seeing decreases or no change. This makes sense given how the COVID-19 pandemic has impacted the way services have been delivered. But looking forward, it looks like nearly 70% of organizations are expecting significant or some increases in the need for services. And then also almost 86% of our respondents think that or have had to change the manner in which they provide services. And only a few are unsure. So those might be those that are opening back up soon. So there is a lot more information in that report. We appreciate you all completing the survey responses. Those closed on Tuesday. And so we wanted to make sure we hit the highlights for this presentation today, but we anticipate that we'll be doing further analysis and sending out additional opportunities to provide feedback to see how any change over time. So with that, I will turn it back over to Steve.
Again, thank you so much, and big thanks again to you and Rachel for all the work on this survey and then putting together results. And big thanks to our partners for completing the survey. Okay, let's move on to kind of our local funding update. Needless to say, everybody's been moving, really quickly and trying to figure out things as we go. So we thought it might be good to just pause and talk with our nonprofit partners about funding. I know that's on everyone's mind. So we wanted to talk just quickly about which funding source you should apply for. Again, we moved pretty quickly, and I know because we moved so quickly, we were able to access some external funding sources. I know the United Way was able to work with some larger foundations like the Foundation for Health to access some resources. I think in large part based on our relationship, but mainly because we acted so quickly as a community to start raising and allocating resources. So again, we were able to move quite a bit of money out, raise quite a bit, move it out. At this point, though, as John alluded to earlier, the needs, are definitely exceeding the resources available. Based on the reporting from the survey, you've seen the anticipated loss in fundraising revenues. I think one of the things we want to talk about today is it's very likely we'll never be able at CoMoHelps to be able to replace all those lost revenues. So we wanted to tell folks moving forward that what is really helpful is if you will submit applications to CoMoHelps for needs that were caused by or in response to the COVID-19 pandemic. Those are the ones you should submit to CoMoHelps. And when you do that, we really need you to tie those to services and activities. The proposals that are much more difficult for us to consider are ones that just simply say we have lost revenue and we need to replace that revenue. There aren't any nonprofits making money. So any revenues that you guys generate, whether it's the grants or fundraising or service fees, those go to support operations. None of us are getting rich in this business. So what we need for you to do is to convert that information particularly when you do your budget rationale to services and activities. So try to tie those to our taxonomy of services and make sure that you put dollar amounts on the things that you need operationally. That could include, some infrastructure items, like if you need plexiglass to safely provide things, those are perfectly fine. There are other things so let's say that you've got some deferred building maintenance and you need to install safety systems in your building and you needed to do that last year and you weren't able to do it. Those are needs, we understand that, but they're not appropriate for CoMoHelps because they're really not related to the pandemic. So again, in your proposals to CoMoHelps, make sure that you can relate that to the pandemic and then really try to convert those requests into operational needs. The other thing we wanted to remind folks, because we were getting a lot of requests, is that we created a separate and very simple process, thanks to our friends at Veterans United Foundation, for accessing disinfecting items and to some degree PPE, which is, we know, hard to get. So on the CoMoHelps.org site, you really have two different ways to ask for assistance. One is the application for funding, and the other is a link to a survey where you can ask for disinfecting supplies and PPE. Again, Veterans United Foundation is both funding that and running that. Anyway, if you will just note those things as you submit requests. I do want to note that the last order process through the Veterans United supplies process is closed. We plan to reopen that, we think, on Monday. So we'll try to keep you posted. But if that survey is closed, just keep checking back. And again, we'll try to keep folks posted on that. Just keep in mind that this is actual Veterans United staff running the show. So they're trying to do their regular jobs plus their working on that. So just be patient as we do that. The other thing we need your patience with is trying to get masks. I can tell you that those, even as the public health entity, we have great difficulty accessing those. I will wear my public health hat here. If you are buying masks, please try to get the non-surgical type. We really need the medical grade surgical types for medical providers who are in close and long time contact. And so just the basic masks are fine. They're cheaper, and it lets us keep the stock of surgical grade masks for the medical providers. I do realize there are some providers on the call, and obviously if you're providing healthcare, you should use the appropriate PPE. And again, I want to also emphasize on that front, if you have questions about that and about PPE, we can also handle those questions through the business guidance at como.gov email. Just send those questions to us. We are more than happy to consult with folks one-on-one. Okay, so just to wrap up, if you need funds for operations that are related to or caused by the pandemic, that's appropriate for CoMoHelps. If not, then we're going to turn to each of our local funders to talk about, really our best term is our regular funding. So I'm going to move on to the Boone County, and I'll turn it over to Joanne to talk about Boone County's funding.
Thanks, Steve. The Children's Services Fund right now is anticipating releasing a targeted RFP. This is yet to be decided, but is probably going to be based on the needs in schools. We were supposed to, as many of you know, and probably were going to attend, we were going to have a youth violence at the beginning of March, a little conference on that, but it got canceled in the last minute. So we're going to be putting that on hold, but moving forward to an RFP to address needs in schools. And that should probably be released in probably July. That's what we're hoping for. I wanted to let you know that the Community Health Fund is no longer accepting any type of applications. This is mainly due because the money is funded. We get approximately $500,000 a year through the Boone Hospital lease. And as many of you know, the hospital lease expires on December of this year. So we'll be no longer accepting new applications. It's sad because we really have utilized quite a bit of money on emergency responses from this health fund. So the best thing the best recommendation I can have you guys do is, if you're not already a vendor, I encourage you to sign up as a vendor with the Boone County Community Purchasing Department. And anytime we release an RFP, you will be notified of that release of the RFP. And if you need help, you can contact our office, and I'll have Kristen put down the community services email, and we'll respond to that if you need any assistance with that. Thanks, Steve. Thanks
so much, Joanne. Okay, the next one is me. Many of you know the City of Columbia is a funder, or we contract for social services in the community with community-based providers. We plan to issue our regular RFP on schedule on July 20th. The issue area, I think many of you know, we went to a 2-year cycle with 2 areas: basic needs and opportunity. We have not yet chosen the services that will be included in that RFP, but all of that information is up to date on our website, including the calendar for the RFP. We just have not worked out the details of that. We don't release the details until the RFP is issued, and again, that will be on July 20th. I want to add, when we send a follow-up email, we'll put all of our contact information for all the presenters in there, so that if you need to reach us. If you aren't already signed up, the best way to get information about the city's social services funding, but also I send all the updates about the pandemic, is through our listserv. And I'll put a link to that in our follow-up email, but you just go to the city's website and search for webmail, and you can pick the Human Services Update listserv. And we'll put a link to that in the follow-up email as well. I'm going to turn it over to my friend and colleague, Randy Cole, with our Housing Programs Division to talk about CDBG and home funding.
All right, thanks, Steve. I'll be quick. I have to step off here by 11 for another meeting. Yeah, we have quite a bit of funds coming from HUD through the CARES Act. We received our award letter for the first round of funding, which would be about $573,000. It all has to be related to in response to the pandemic and in alignment with what we would typically fund with CDBG funds. So our commission is voted to do a targeted RFP that was released yesterday and being sent out on our listserv today for additional rent and mortgage assistance. Proposals will be due on June 5th. And we would hope the council would consider agreements for those proposals in mid to late July. Also out of that funding round, we're looking at doing $200,000 to the micro enterprise program, in particular focusing on minority-owned businesses that were not able to access PPP. That's been a really big high priority. We have quite a bit of wait lists we're building to help those individuals and businesses out. And then looking at assisting with isolation and quarantine and other public services for vulnerable and homeless populations. Our next funding round, 2021, we typically do our funding rounds in the spring, but we pushed this back due to the pandemic. And we may likely also have an additional round of CDBG CARES Act funding in addition to that $573,000 to mix in. We're still awaiting some guidance from HUD on if that's being released and how we'll apply to it, and if it'll be kind of a similar amount to that first round. But nonetheless, we'll have about 1.5 in our normal funding that we will, our commission will be meeting in June to look at if we want to rearrange some of our priorities to help respond to the pandemic, but also in alignment with what we traditionally fund. So it would likely mean more affordable housing assistance, maybe some assistance for small businesses. But an issue we see a lot with is assisting with facilities that serve homeless populations. I think there's also some interest in our commission in supporting nonprofits with any kind of facility modifications that might be needed that CDBG could assist with. So those are some of the things that they'll be discussing and looking at going forward. But that RFP opens July 1st, and proposals would be due by August 14th. And you can kind of see the schedule there. So that's what we're looking at coming up for our group. So thank you, Steve.
Randy, thank you so much. Turn over to John Baker, the director of the Community Foundation of Central Missouri, to talk about their regular funding.
Thank you, Steve. Mine might be a little confusing because we are a regional community foundation, which is beyond Columbia and Boone County. So if you have interest in CoMoHelps pandemic relief grants and you're from the local area, we want you to follow through and make your application through CoMoHelps.org, as we've been mentioning throughout this meeting. If you are a leader of an organization that is outside of Boone County in our area of service, then we have another application for you to use. So contact me directly and I will send you a link to that application. We're servicing other counties besides just Boone, and it's on our map on our website at cfcmfoundation.org. For everybody in Central Missouri in our counties of service, we do have our summer granting cycle annually. And this is an application window that will open up at the end of June and will close at the end of August. And then we will make decisions by the fall for money to be delivered about the end of the year. Late November is when the checks usually go out. So that's a process that is available to you. These are smallish grants. They're called community service grants, or we have one larger grant called a community impact grant. And that's for any nonprofit in this area. We are a all-encompassing funder from everything from infrastructure to animals to human services to arts and everything in between. Grants that we offer, in all honesty, are offered based on discerned social value and impact of each application. So we hope that when you apply, you will apply for something specific, something that's meaningful, and something which will impact lives. That's what I had to say, Steve.
Great, John. So just to recap, the Community Foundation is pretty unique. So if you have pandemic-related requests and you're in Boone County, go ahead and fill out the CoMoHelps application. If it's pandemic-related and you're outside of Boone, contact John, and again, we'll send contact info, and he'll work with you on that. Otherwise, if it's non-pandemic related, no matter where you are, you would just use the typical Community Foundation process.
Perfect.
Thank you so much, John. Okay, let's turn it over to Andrew Graybaugh with the Heart of Missouri United Way.
Great, thank you. I know we're running close on time here too, so let me just reiterate that this is all going to be available. And this content here was sent out in an email last week as well, so you can reference the email that I sent to all of our partners last week. Please know that this process was really made with a focus on equity and making sure that we adhere to the principles of community that we espouse as the foundation of our work, and also with our commitment to ensuring the safety of everyone. So the email that went out references the 6-month interim grant process that will help to ensure that grants that have an existing funding relationship with United Way can have an interim grant that would continue through the rest of this calendar year. Rachel and Courtney will confirm with applicants on making sure that the award requirements are met, and our board is expected to vote on this process at our June board meeting. So our goal is to have everything finalized during the month of June, so we'll be ready to go on July 1, and the interim grant could pick up right after the other grant ends at the end of the month. So be on the lookout for that if you have a current grant with Health and Basic Needs through United Way. The larger part about our 3-year investment cycle, I wanted to take just a minute to talk about that, because we started our Health and Basic Needs impact cycle back at the beginning of this year. And it was the decision of our board to go ahead and to move forward with having these grants start on July 1st of 2021. And so we're going to we have a new timeline for reaching this investment decision. So if you're an organization with a current proposal submitted, you'll have an opportunity to update that proposal. And Rachel and Courtney, again, will be in touch with you about the process details. We're going to have clear expectations, again, using that equity lens and making sure that it's fair and equitable for everyone. We'll make sure that our advisory council volunteers will have the right training in place for conducting site visits. We'll make sure that we shorten the site visits so it doesn't reflect that 2-hour block model that we used for in-person site visits. And then our advisory council volunteers will make those recommendations in October, with our board then voting on those new grants at the November board meeting. This modified process will allow organizations to go into 2021 with increased certainty. And one of the benefits of this, it will align with grant reporting periods with the city and the county, which I think is a pretty good opportunity to have and to utilize. United Way is going to conduct a budget analysis to determine the feasibility of scheduling each impact investment cycle in the future under this timeline. And so, as always, as we go through this, we want your feedback because it's highly valued, and we want to make sure that this process gets better and better in meeting the needs in our community. So thank you for everything that you guys do in the community, and I can answer any questions. Rachel and Courtney can as well about this process.
Andrew, thank you so much. And I know many of you know the City, County, and United Way partner on a year-round regular basis, and we really have an eye towards making things simpler with our single application and single reporting system. And we're really excited about the possibility of aligning all of our fiscal years for funding together. So that's great news. Thank you so much, Andrew. Okay, let's turn it back over to Eric Morse to close this out with the Veterans United Foundation.
Thank you, Steve. I'll close this out very quickly. Have some basic information here. Some of our local partners are here, and that's great. And also some people who have maybe even just received some funding for programs or needs before. We are a little different in the way we do our funding. Sometimes we can respond rather quickly and don't have a certain time during which we have to accept applications. We actually meet for funding cycles every 2 weeks for funding different programs or needs that people have. So We hope to continue to work with our local partners, and maybe even that some of you will become people that we support that we haven't worked with before. You can see here that we will be still working with CoMoHelps for the emergency relief. We're still on board for long-term recovery as well. And as Steve mentioned earlier, the PPE is still in effect. We'll be getting that survey back up and running early next week. And we do know that there are some state and federal efforts going into PPE as well. So we're hoping we can use that for bridging the gap for what you weren't able to receive that way. But we will be using that survey to see the need. And then, as Steve mentioned, we have some staff that is doing the ordering and distribution of that. So normally we'll take our applications for funds through our website, which is enhancedlives.com. That's where you can learn more about the Veterans United Foundation and also how to apply for funding. And one more thing that you see down here at the end, we are in some ways able to support different organizations than some of the other groups can, or just in different ways, but also we can help individuals. And sometimes we can help individuals financially with needs that they have. And we've worked with some of the people on this call before where they've been working with people to help them with just some of their basic needs or health services or social services. Maybe they are just about ready to get a job or move into their own home or become self-sufficient in some way, but for the fact that they can't get this one thing. And so sometimes we're able to help people bridge the gap individually as well. And we love to continue the opportunity, especially when we can partner with some of the agencies and organizations that we know have already vetted these individuals and their needs and have led them to a place where we might be able to help them get where they need to be. So please reach out to us for those kind of needs as well. And we look forward to continuing to work with you and maybe working with some of the new organizations and causes as well. Thanks, Steve.
Eric, thanks again. And again, Veterans United Foundation's unique. And Eric, correct me if I'm wrong, but you're still seeking a pandemic-related request through CoMoHelps. Otherwise, like the Community Foundation, use the standard process. I think that's...
Yeah, correct.
Okay, great. Thank you. And again, happy birthday, and hope you have a great one.
Thank you.
Okay, Kristen's been watching our questions. I think we just had a couple, but they were pretty specific. So she reached back out to those people. It didn't look like we had any real general questions, and we're out of time, although we did pretty good. So I just want to remind folks that we did record this, and so we'll make the recording and the PowerPoint available. We're also going to send a follow-up email with contact information for all of our presenters and maybe some other links that are important. Again, our site to ask for assistance in response to the pandemic is CoMoHelps.org. And again, that contains the links to both the funding application and the disinfecting and PPE survey link. I want to thank all of our guests. I'm not going to go through everyone because it was a long list and we're out of time, but big thanks. But I want to end by thanking our nonprofit partners. You may have heard me say, I feel like many of our nonprofit providers are the forgotten first responders. Many of you have remained open. Some of you even expanded services during the pandemic. So I always think of our nonprofit friends as our forgotten first responders. So big thanks to all you guys. And we really can't thank you enough for all the great work that you do. And we're here to support you. So I hope everyone stays safe, and we'll all talk soon. Thanks, everyone.